This week it was revealed a football player at the University of Waterloo was recently punished for doing something now legal in Canada. He consumed cannabis. Lucas Merlin is a fourth-year defensive back. He's been suspended for 2 months after THC turned up in a urine test. Luckily for Merlin, the season is over, but his suspension has sparked a debate. Should college and university athletes be allowed to use pot now that Canada has legalized it? Paul Malia is the president and CEO of the Canadian Centre for Ethics in Sport. Hi, Mr. Malia. Nice to see you.
Oh, thank you. Nice to meet you.
Thank you for coming in. Why is cannabis still a banned substance, even though it's now legal in Canada?
Yeah, that's confusing for some people, I think. But the legality of cannabis in Canada, having been made legal in October, doesn't change the status of cannabis as a banned substance on the banned list for doping. And that's primarily because the reason that it's on the list isn't whether it's legal or not. There are many drugs that are legal in Canada but banned in sport. I think Ritalin to treat ADHD or different asthma inhalers, insulin. So they're legal, but they're banned in sport. And they're banned in sport because they believe in sport that they actually confer a performance-enhancing advantage to the athlete, and used in large amounts are harmful to the health of the athlete.
What is the performance-enhancing aspect of marijuana, though?
Yeah, in the case of cannabis, it's it's actually debated quite a bit. What are the performance-enhancing benefits? Those who argue that it is performance-enhancing, they speak to the pain management, the reduction of pain, and so the ability to play through pain. But mostly it's the inhibition of fear when it comes to marijuana cannabis, right? So an athlete consuming that in a competition is going to have their fear reduced, and they're going to be willing to take greater risks. So in some sports, that willingness to push yourself beyond that, risk tolerance limit that you might normally have is a performance-enhancing benefit. But at the same time, it really increases, the risk of your health and safety.
Is there evidence that it does amplify an athlete's ability to take more risks or to limit fear? Is that evidence from your perspective, from your organization's perspective, conclusive?
Well, I think the scientific evidence is not really solid, although having said that, that's our perspective at the Center for Ethics in Sport, and we would, on an annual basis, make that recommendation to the World Anti-Doping Agency that we think marijuana should come off the list, because we're not convinced that the evidence is strong enough with respect to its performance-enhancing properties. But the list committee and other stakeholders around the world feel otherwise. They feel that, yeah, athletes are using marijuana to enhance their performance. And even if it doesn't, they believe it does, and they're using it in large amounts, and that's harmful to their health.
So if your organization, let's say, is willing to advocate for it being taken off the list, is there the possibility that you could develop your own policy? I would note, for example, that the CFL doesn't ban it, for example. The NHL has its own policy on it as well. Is it possible for your organization to develop a policy for those athletes who don't have to adhere to international standards, who, for example, just compete within Canada?
Well, for example, we provide the testing services for the CFL. So we administer their drug policy for them. And so in that sense, we have done exactly what you've said. But for most of the sport organizations in Canada, those who have adopted the Canadian Anti-Doping Program into their rules, the Canadian Anti-Doping Program is the World Anti-Doping Code applied in Canada. And the World Anti-Doping Code has one banned list, and marijuana is on that list. So all of our Olympic athletes, Paralympic athletes, any athlete that is representing Canada internationally in competition needs to demonstrate to their international sport governing body that they've been subject to the World Anti-Doping Code. And we do that through the CADP in Canada.
That makes sense to me. Obviously, if you're competing internationally, you have to adhere to a certain set of standards. We've seen the results when that doesn't happen. But like I said, is there any mechanism, I guess, to address the fact that it's legal in Canada if you're an athlete simply competing, for example, within the Canadian university system, not internationally at all, like you're on a football team and you're competing in that league?
Right. So with youth sport, it's a little complicated because there's a bit of crossover, not in football, but in some sports where the youth sport athlete is actually you know, on Canada's track team or on Canada's swimming team, and they are competing internationally as well as within youth sport. So we have to be aware of that. But at the same time, I think youth sport wants their athletes to be subject to the most effective anti-doping policy that we have, and that is the CADP. That banned list and the way in which we carry out our testing, the sanctions that are associated with it, that's the gold standard, and so youth sport wants that for their athletes.
I guess I just wonder if where cannabis is concerned, I mean, I can imagine for young athletes, it's legal, the evidence isn't particularly scientifically conclusive. Is there a way around it? Do you think in the future it will be, I know you said your organization advocates for it being taken off that list. Do you see any possibility of that as the sort of movement for legalization grows? Or is that something that you'll be revisiting kind of annually, et cetera?
Yeah, we will revisit it annually, and I can't see into the future, but I would say that and it's really important to separate the legality because it actually has nothing to do with its status on the banned list. So
I take your point about Ritalin, Tylenol in some cases, for example.
Right. So what they'll be looking at is, you know, how many athletes are actually using it and what quantities are they using it in, and is that consistent with using it to enhance performance, and are those quantities at such a high level that they really pose a significant risk to the athlete? Those things will keep it on the list. If it starts to disappear, then it might come off the list.
Okay, I'll leave it there. Thank you so much, Mr. Malia. I appreciate your time.
Okay, you're welcome.